such a time when many have lost their lives and others are still struggling, you're able and you're alive and kicking. Thank him for that. And of course, here in Good Morning Uganda Extra, we also thank God for you who's our ardent viewer every day, knowing that you're there, you're waiting for us for informative discussions at our national building. I'm Robert Chirabo Nyonyintano, and this morning I'm with the man himself, Jagenda Semakula. I don't know if Jagenda is excited about the midterm NSSF access to those that have served for 10 years and clock 45. I don't know how soon, if he is in that category, if he's to be entitled, how many years are remaining, that I'm also not sure. But let me first get it from him, Jagena. Good morning.
Well, a very good morning to you, Chirabo Nyonyintano, Omwana Wumsumba, and good morning to, of course, all our viewers today. It's another very lovely day. It is the 25th of November. Today is Tamale Mirundi's birthday.
Oh, okay.
And today is Pastor Losias Wijingo's birthday. So
all of them are
the two men share their birthday today. The pastor,
very interesting. That took him on earth on this very day.
Exactly. Pastor,
the years could have differed.
Of course, the years are different.
Yeah.
Pastor Wijingo and Tamale Mirundi. Because I was born in November, on the 1st of November, I share my birthday with my mother. I love November, and I very much try to find and know who was born in November.
What a combination this time.
I try to find those famous November borns.
Controversial people.
I don't
in one way or the other.
I don't think they're controversial.
All have a huge following, by the way, because of their mode of communication.
So the famous ones for November who were born today are Pastor Wijingo and Tamale Mirundi. So, well, secondly, on the excitement of the midterm payments of NSSF, I also followed the debate in Parliament for the past days when they were discussing and talking about it. But yet again, I'm not excited as an individual, and I have my personal reasons why. Two, I think for those who qualify, yes, it is okay. But this is a social security fund. And when you talk about a social security fund, you first of all need to know what it is and maybe why it was put there. So I saw, well,
you kind of think it would befit the purpose.
Exactly.
But because you only get a 20%. You still have the other.
Yes, and I think it's okay, but you see, you also need to, for those who, because 20% has to be translated into how much. The percentage.
How much you've saved.
Exactly. Yes. In I think it was in 2008 or 2011, thereabout, when we had the issues of Temangalo. You remember when we had the issues of NSSF and Temangalo?
Well, we had a willing buyer and willing seller.
The debate of Temangalo, of course, brought NSSF out very vividly and very publicly. And I found out at that time, because that was before, that's the time I think when, I'm trying to remember, I think it was Jamua then, David Chandi Jamua, who was I think in the fund. I tried to find out how many people were serving with NSSF at that time. And the numbers of the savers with the fund of NSSF were not, I think, even 1% of the people were making noise. So majority of us were making noise. We're talking about a fund that we do not even serve with, that we do not even belong to.
Currently, you have about 2 million savers with NSSF, and those that could be entitled to this midterm may not even make 10,000.
Exactly. That's why I'm actually talking about it. That to me, there is no excitement, and the people who actually have good money from that fund, who would even actually desire or would want to get the 20%, again, the people who don't even need it. I know people who save, whose remittances to the fund 3, 4, 5, 6, 7, 8 millions. That's their remittances to the fund.
And of course, now, by their position, they may not need this
That's
midterm.
what I'm saying.
Well,
if my employer...
Let's close this.
If my employer remits 8 million shillings, if my employer remits 4 million, 5 million shillings to the fund, for me, then I can't actually need 20%. There is no time that I can actually get where I am and say, Bampe yoko 20% and see what I can do with it. So yes, for those that it can actually benefit for quite a number of those. Personally, I'm not, but it's okay because it's not about me. It is about Ugandans, and it's about the people who save with the funds. So we congratulate the members of Parliament, of course, for having passed that bill, and we now wait for the President's signature to set to it into law. I hope this time he does signs against it, or he assents to it, for it to be operationalized and to be a law in this country.
Well, away from that, and that is Jagena's opinion. Remember, that was also a poll question earlier on. We now move to our topic this morning regarding steel work and welfare, which is the ongoing strike by doctors. By Sunday midnight, the industrial action had taken place. Yesterday, His Excellency met, that is the leadership of the Uganda Medical Association, and of course led by their president, Dr. Sam Oledo, and they discussed a number of issues. His Excellency talked about proper staffing, improving their welfare, enhancement as well. But the doctors still insist that this has not been the first time. Since they had a meeting in 2018, there was one even earlier this year and a second one. And by morning after that meeting, they had issued a statement. Jagana, I'm going to read through briefly just to shape our discussion. That is Uganda Medical Association. Uganda Medical Association National Executive Committee, together with the UMA Elders Forum, had a day-long meeting with His Excellency, the President of the Republic of Uganda, at State House Entebbe. We discussed a number of issues that include medical supplies, disease prevention, employment of doctors, and ultimately enhancing welfare of health workers, including salary enhancement and other benefits. We are waiting for commitment from the government, implementation plan, and tangible, desirable solutions. Until then, we maintain the status quo in regards to the industrial action. We remain committed to quality healthcare and welfare of medical doctors in Uganda. Signed by Dr. Odong Samuel Oledo, that is the President of the Uganda Medical Association, and Dr. Herbert Luswata, Secretary General. First, industrial action is a right.
It is.
It is a right.
It is.
But medicine is also a noble profession. But unlike other professions, it is a life-saving profession. Of course, we know in laws that govern such industrial action for doctors, they leave a skeleton of staff. But let's first understand, in understanding this profession, this noble profession, Jag and I and you are not working, may not kill someone. Though we are the fourth estate, we may warn of what is happening, and people may not go there. But when doctors choose to put down equipment, let's look at the ethical bit of it and the call and commitment for work. To begin with that.
Well, I think, like you said, industrial action is a human right, and secondly, it did not happen in an overnight. It was not spontaneous. This is something, when you listen to Dr. Dong Oledo of the EMA and the doctors themselves, they've had these pressing issues for quite a number of time. And I think they've repeatedly, through their umbrella organization, the association, and the different forums that they do or use to engage with the government. And I think it's just out of desperation that they have decided to go this far. Now, it's not the first time that doctors are striking in this country. It's not the first time that doctors are actually saying, we'll put down our equipment and get there. But I think what is most important is look into the issues that they're bringing forth that is causing all these things. What comes to the mind of a common Ugandan is that it's just about salary enhancement. Many people think about salaries and say they do not have enough salaries. Yes, that's one of them, but they also have the other issues. Now, what needs to be done is we also need to look at statistics. We need to study these things critically. How many doctors do we produce in all the various medical schools that we have across the country? How many of these do we produce as specialists that keep coming out? For every year, I think they have records that we produce, I think every year, about 500 doctors. We're now calling them doctors or health workers in a way. And we look at those. We're talking about specialists, for example, and quite a number of them. To me, what I think needs to be done is we need to also look into this profession. We need to look into these issues of the medical doctors, critically examine them, understand them. I read a tweet, I think, a posting by Dr. Ayume. Charles Ayume is called Charles Ayume. I normally call him Francis Ayume.
I think this was the tweet. Chairman of the Health Committee of Parliament, Dr. Charles Ayume, called on all fellow medical colleagues to call off the proposed strike. Said that was before the strike. Said to my fellow medical colleagues, Parliament approved a supplementary request that were presented. These include money for salary enhancement for intern doctors under vote 0114.
Yes.
I therefore advise the interns to call off their proposed strike, slated for that was 22nd of November this very year, Ayume said in a post. But also, these doctors, according to their chairperson, is for the last 4 years, we've been engaging government and all relevant officials to look into issues that when you really look at the issues that they're bringing on table, why they had to come up with this strike. Issues like salary, that is one of them, but also they are looking at equipment in hospitals that they need to work because they will tell you that we do not have enough equipment, supplies. And also they're looking at staffing of these health institutions that away from the supplies, even the staffing is really low. The payment is low. They're looking at some of the issues like transport as well, things that facilitate them to work, but also, on the other hand, benefit who their clientele is.
To me, I think yes, because we talk about so many graduate doctors or nurses or medical workers that we keep getting from different universities or different medical schools across the country for the year. But let's just get into what has just been happening to us. When we had COVID at its peak in this country, remember we had these the COVID treatment units at the different regional facilities across the country. And one of the things that I had an opportunity to interact with some of these people who were working in these different units in Lira, in Mbarara, and elsewhere. And you would notice that people would come to these hospitals, people would be put into these units, the patients would be put into these units, but yet again, there were not very many or enough staff, enough medical staff to actually handle these people. And you could see somebody in dressed in PPEs attending to this patient, and you see, COVID is not like the other diseases that we've had here, HIV, AIDS, malaria, and stuff like that, because somebody comes and they have malaria and you know how to treat them until you discharge them. But somebody comes and they are asymptomatic, they come to this COVID facility in just maybe hours or just days, they deteriorate. You look at somebody who came in smiling, they came in walking by themselves, and they deteriorate to very dangerous stages, to even death, to times when we had this toll rising and getting bigger. And you could just imagine the psyche of this person, the mentality, and the trauma, and quite a number of things. So human capital development, to me, I think is also what we need to do is we need not to just look at the persons, the practitioners in there, but just look at this whole sector called the health sector. I think it's a priority that we need to set as a country. When you go to the UK, they talk about the NHS. When COVID had just hit the country in the beginning times of last year in 2020, you could hear Prime Minister Borisson, you could hear the Minister of Health there, you could hear everybody in the UK government saying, please, let's do what we can do to save the NHS. Now, they were struggling to save their national health systems. They were struggling to save their NHS, not even the lives of people. And they got to a level of telling people that, please, if...
Their slogan.
Exactly.
It was their slogan.
Save the NHS.
Stay home, save the NHS. NHS.
Exactly.
Why
Stay at home.
yeah.
Exactly. You know, if you can't manage it from the house, please do it. Manage it there and don't come. If you can't manage it from the confines of your apartment or your home, please do it there and don't come to, because we need to save this. Now, do we think about saving our own health systems? Do we even have a health system to save? And I think that's where it should be. But before we talk about Dr. Odong, before we talk about NASX, NASY, or so and so, I think it's also very important that we have this thing that we look at and hold with all this esteem and say, this is our health sector and it is a life-saving sector. It's the health sector. It is a life-saving sector. What do we need to do? In the region, the East African region, East Africa, Eastern Africa, and I think on the continent of Africa, by and large, it is just the Uganda Cancer Institute that stayed open to manage cancer patients, to manage cancer issues, as we're also battling with COVID-19. All these other facilities in South Africa, in Alexandria, in Egypt and elsewhere, all these big economies on the continent that we talk about, that we know, in the region here, Kenya, everywhere, they closed almost everything and said we're putting all our energies to fighting COVID-19. We stayed with us open here, and cancer patients, cancer people had to still come in, do it was actually happening, and that's a given to us. But you also need to go back and know what was the cost of actually doing that. Is it because they were remunerated very well? Is it because there were lots of salaries that we're getting? Is it because now there are these sacrifices that these people have also been doing that we've not considered, or that we've not looked into? So I think when they get to a strike like this, we need now to get back to our policymakers. We need to get back to the powers that be and say, let's look into the issues that may
causing this strike.
Exactly.
And maybe just a recap for our viewers as we discuss this doctors' strike and of course most on their welfare. What are they have put specifically 5 areas of concern, and that is unless government heeds to their 5 demands, which include passing a supplementary budget for salary enhancement. That is something that the parliamentary committee has to quicken, and of course,
let's first talk about that, because you see, salary enhancement, salaries cannot keep coming through supplementary budgets, because a salary is a recurrent expenditure. So we need to find a lasting solution to that, because and we need to know when we talk about salary enhancements, it is what are we talking about? Now we're saying we can't say there is a specific amount of money that everybody is going to get, but you can only talk about percentages. You like talking about percentages more about some economics and
actually here I was listening to Dr. Charles Ayume, and he said that actually what we've been spending, we need like 35 billion shillings. That is what we need to cater for such, compared to what we've been having, which is 12 billion that has been going into this. So he says that is a big increment in one way or the other.
Yeah, but
and remember, you have to sustain it
exactly
forever. That every doctor at this level, if they have 5 million, a beginning doctor, even if there are a million in the country, that is it.
Exactly. Now, when you talk about 35 billion shillings as an increment, then that means government has to plan. Government has to plan and say, we need 35 billion shillings. Now, is that for a year or for a month?
Annually.
That's annually. Okay, that's a very good one. That government needs to plan and say, for every year, annually, and now that means you will have to again keep them at that particular pay for maybe 5 years, and say for the next 5 years, this is what is going to be. So you need to find a source, because this is a recurrent expenditure, and we need to look into it and say, yes, these people need salary increments, and I think just like, because there is not a single day that we can see members of parliament in this country striking over these issues.
No, definitely not.
They can't strike over these issues. There are strikes, they are hit and bang, and they are actually over very different issues. We can't see members of parliament saying we are striking because we do not have enough salaries, we are striking because we do not have what do they call them, books of rules of procedure, we are striking because we do not have maybe microphones to use to speak, we are striking maybe because we do not have enough office space where to sit and do work, we are striking not because of
their boycotts are basically
on
practical
things.
grounds.
Exactly. So I think that's where we now need to get to these issues and say, okay, all of us need these. All of us, to me, it's actually not about the doctors themselves. It is about the health system. We also have to have that health system that we can take pride in and say, we need our health system to be operational, to be functional, to be with all the things. Now, having all the things in there and say the operators in there are remunerated very well, the equipment is there, this is there, that is there for all of us to and I think
so that was requirement number one. That's the supplementary budget that is going to enhance, then boost medical supplies. What you talked about, COVID-19 here, that is the protective gears, where a doctor would spend longer sweating, and some would compromise their health because of fatigue. And
we lost some, actually.
Yes.
We lost quite a number of them. That's a
other technologies, employing all doctors, compensating families of health workers who have succumbed to COVID-19 in the line of duty, and prioritizing their welfare outside salary. The health workers have resolved to lay down until. So,
you employing everybody. Well, I don't think. Well, now that's also another one.
But that's an assurance. Yesterday, while the president was meeting them, he was very clear. He directed that all doctors, all newly qualified doctors, were assured of a salary of 5 million per month, with effect from 2022-2023 financial year, and said there is no need to create that is friction. But he also assured them that all doctors are going to be employed. While meeting them, he assured them, once you are a graduate doctor, once you're out, we should be able to absorb you as a country.
Because yes, you invest in your life, or invest in you, or whatever that is, and we need that service. We need that service to be given to Ugandans. Why would you go to medical school? Why would you graduate out of medical school and not be employed, and not serve, and not actually get into employment? Why? Because when we're growing, these are some of the professions that we had people talk about. You either had to grow into a doctor, or a lawyer, or a teacher, or an engineer, and these were the professions that all of us.
Disappointment is was not craving for service delivery, but for the remuneration that is there. Most of the times in schools.
Yeah, but even
because some of these professions.
But even service delivery
are supposed to be a calling in one way or the other. So the mistake we make is when we go into them with the aim of making money. When we were in school, you rightly said, Agenda, I want to be a lawyer, I want to be a doctor, I want to be an engineer. I've forgotten the fourth thing. Reason, if you ask them.
The other was a teacher.
Teacher?
Yeah, the other was a teacher. People grew up into being teachers. I wanted to be a teacher myself, and that's why I teach.
Sure.
Oh yeah, I wanted to be a teacher. Of the many things that I wanted to be, one of them was being a teacher. I had about 5 things that I wanted to be, but one of them was actually being a teacher, and that's why I actually respect teachers. But when we get back to what we talk about here is yes, for example, you're now talking about doctors, but the biggest majority of our health workers are actually nurses and midwives. Those others, they constitute about 70-80% of the medical workforce. And when you look into I think the nurses and midwives union, they will also tell you we have about 60,000 of those in the country, and we can only, I think both the government and private sector, it can absorb up maybe about 20,000 of those. So that means you leave another 40,000 trained, qualified nurses and midwives to get our go into other things, vending and let alone even just being in the private sector to serve with and do this, but finding themselves again doing different other things, and yet we need this manpower, we need this workforce, we need these people to actually be in our health facilities or systems or whatever that is. That's why they will talk about having health centers in different areas of our communities. We have a health center, 4s, 3s, you know, and they'll tell you Tetrina Basawan, Tetrina these. Why would we even have a hospital somewhere and we do not have a district medical officer yet in Sipa here? So what I think needs to be done is it shouldn't be an issue of only the doctors talk about it in Parliament. It shouldn't be Dr. Ayume because he's a qualified medical doctor. It shouldn't be his responsibility to just talk about it. It should be a duty of all our legislators to actually say we need this service. service, because you as a member of parliament, or who is a lawyer or a teacher or a journalist or an artist or a musician, whatever you are, you still have also to, you get the services. You have people who go to these hospitals and get the services. So I think we shouldn't leave it to the Odedos here, we shouldn't leave it to their associations, their unions and everything. It should be a campaign of all of us to actually push and say, we need it. We need them to be happy. We need them to, all of us need salary increments. But we need to also consider that, yes, these people have had these issues, they've spoken to government, talked to government, and we want to think that maybe for this particular time round, when they say and make the promise of the next financial year in 2020, when they make the promise of 2022 financial year, then we hope that when it comes to the time now, that still means we're talking about July of the coming year. So it's our thinking that when it gets there, maybe this time round, we will actually see government responding, yielding to their needs, and it shouldn't just be, we shouldn't think it's only a salary bit of it. You've just read to us here. A combination of 5 factors. So we need to look into them. Who would want to work without equipment to use? And I think the equipment, not just the PPEs alone that they use, it's part of
Actually,
them.
the term is health supplies generally.
Exactly, the health supplies. Because I think to them, would they want to get a salary and they do not have the medicines to administer, and they do not have the equipment to do what they're supposed to do? So I think these are all things that we need to look into.
But today we are discussing doctors. Of course, the nurses under their union, they say they're not part of the strike. It is basically now for medical. At a time, we had lecturers in public universities. Then we had teachers. This bit-by-bit handling, don't you think we need either a commission to review general salaries? Because at the end of the day, you have the doctors, the nurses. What if then you have pilots? Then you have this and that. Because at one time, I remember Ministry of Public Service said they're going to come up with a commission that is going to look at the entire system and see how best we can. Of course, this has financial implications on our budget as well, because money that goes to salaries may in one way or the other. Yes, there's a trickle-down effect to the economy, but it may not be that direct.
Me, I never agree that this country does not have money. I never agree that this country does not have money.
So if we have the money, are we now not getting our priorities right?
Yes, exactly. This country has all the money that we need. We don't need more money on top of what we have to make things work here, and to see things and to change stuff. We don't need more money. We have the money here. It's just about our priorities. This country has got all the money that you would think of, that you would imagine. So when people talk about
budget constraints,
because
this is our expected revenue and planned expenditure. So if you look at how much can we collect,
this country has money. We don't have money maybe to become a Singapore or to become another South Korea or to become another, no. But there is money here that can actually change this country, that can make Uganda work. The salary discrepancies that we have, you just talked about it here, and the Equal Opportunities Commission, I think, is charged with helping us to manage this thing. You find you find a ministry of government with maybe 7, 8, 9, 10 agencies under that government. But even with the agencies under that sub-ministry, you find that the heads of the different agencies of government actually also get different salaries. And you wonder. Then you keep thinking and saying, okay, if X is the minister and Minister X summons ED, X, Y, Z, A, B, C of all the agencies under his or her ministry to come, and these people come, and now MDY is getting a different salary. MDA is getting a different salary. MDB is getting a different salary. But all these people are under this one. And maybe they're actually even getting more money than maybe the minister or the permanent secretary in there, the directors in there. Now, the discrepancies are just quite a number of things. And we have a lot of money that we put to recurrence, that we put to all those things. There are issues here that you get to and just wonder why all this money is spent on just maybe just doing this or that. So to me, I think if we set our priorities right and say this is what we want, then I think we can make things work and happen. So the issue of salaries, I think it's a very important thing. That's why when you look at the new structures of the teachers, of the teacher setting, what they have a policy, what do they call the teachers?
National teacher,
the national teacher policy. Yes, of course, that's also streamlining that profession of teaching, bring them into one now clean, seamless profession. You notice that one of the things that they talk about in there, of course, the salary enhancements or salary discrepancies that we discussing here. That is a teacher who teaches the same thing. You are a teacher of English in a government school, I am a teacher of English in a private school, but we get different money. We teach the same things, and at the end of the day, your students and my students, or your pupils and my pupils, are going to respond or answer to the same questions that are set by the same body called the Uganda National Examinations Board, or that are set under the same body called UBTEB. Now, you are remunerated differently, I am remunerated differently. We are teaching the same students or the same pupils who are going to respond to the same government exams at the end of the season, at the end of the term, at the end of the year, and these issues are there. So then somebody finds reason to say, but why would I even actually go to a government school when Chirabo's school can actually give me this? So I think we need to
come up with a proper review commission.
Exactly. And
into
somebody,
this matter.
Exactly. And somebody actually says, if I am an engineer at this level in this organization, if I am an engineer in the Ministry of Works, and you are an engineer in maybe another department of government, Civil Aviation Authority, for example, you are an engineer there, I'm an engineer here, there is another engineer in maybe Uganda Road Fund. Why would we get different salaries?
Yes.
Exactly. Why would I be working with one organization, but instead of delivering, instead of doing what I'm supposed to do, I wake up in the morning and the thing I'm doing is I'm looking into the newspapers to see who is advertising for a job somewhere. I am seated on this job, but I am actually applying for another job because I just feel that
this is not giving, greener pastures.
Exactly, this is not giving me
for greener pastures.
Exactly, the person that they want there gets this, but I'm doing the same work here and I'm getting this little. So I think there is a problem in that we need to harmonize. Government needs to think about these things and say we can't do it that way.
Of late, the president's priority has been scientists. We've had lecturers being promised good. We've had various scientists in government bodies that have promised good. And sometimes when it comes to teachers, it even had created disparities, right? So the teaching profession, some walked away from the national body that governs them and formed the Science Teachers National Union. And when you come also, even if you're to go to lecturers, this issue of prioritizing sciences, they're very, very relevant. But in terms of national development and bringing together people in the same profession, seemingly the same profession, what would the impact of this be? No,
me, I have no problem. I actually hated sciences throughout, from maybe primary school, all through and through. I hated sciences. And the only sciences I did, I think I even failed them. I don't think, but I did fail them because I did them, it was compulsive for me to do those sciences. I grew up as an arts man, and I love arts, and everything about me is all arts. But I again respect scientists, and I think, yes, I am not against, and I don't feel bad when the president prioritizes, hypes, and gives them all the credits and credibility and whatever that is. To me, I think yes, because what we need to do is we need to study certain things. I have a son, a foster son, who is in university. The university is called Hokkaido in Japan. He was studying, and he was doing pharmacy at Makerere University before I got him an opportunity to go to Hokkaido University in Japan. He's actually graduating in February. He's done his, I think 6 years or 7 years, because he had 2 years of studying the language, then of course doing all the things. And I keep talking to him about these things, and was telling me about the science industry in Japan. He educates me about, and I don't feel bad that I actually didn't get into sciences. I just admire how they do certain things. And this young man, he's just a very young man. He's in his mid-20s. He's just about 25, 26, 27. He was telling me that you can't find somebody in Japan getting money and building apartments or building what do you call them, these shopping malls. Arcades. And he says you can't find a man in Japan getting money and saying, I am building this whole arcade where you have all the things on 2 hectares of land or something like that. And he says people are looking at the pathogen economy. Actually, what President Museveni was talking about recently when we were celebrating the National Science Week or the Science Day, the pathogen economy, and say people are actually into the pathogen economy, inventing and thinking. What do we do? Somebody thinks and says, I am going to invest $5 million. I'm going to invest this $10 million into the production of a particular medicine. And that's what they're doing. And you know, somebody sits and says, I am a rich man, but I am an arts man. I am this, I'm not a scientist, but I have my money. Now, instead of building and saying, I will construct my skyscrapers there, I will construct and build this arcade or that or put it somewhere, I am actually going to find these young scientists. I am going to find them.
Support them, they develop something, patent it, and I will live for the rest of my life.
Exactly. That's some young man that I'm talking about, represented Uganda. He was one of the 5 Ugandans who went to, in 2017, I think. I want to remember. I think it was 2017. 2016 or 2017. He's one of those young Ugandans who went to represent Uganda in Santa Marta in Colombia. They normally organize, I think it's under the ambits of Google, they organize what they call a mathematics Olympiad. And it's a contest of young teenagers, 16 to 19, from across the world. Now, for the sub-Saharan Africa, we had, I think, Uganda being represented. There was, I think, somebody from Tanzania and maybe South Africa, Nigeria. Now, Uganda had 5 who went to Colombia to represent Uganda through their Uganda Mathematics Society. They have what they call the Uganda Mathematics Society. So this young man is one of those who went, and he competed. Of course, he didn't win. The winner that time was a young girl who was, I think, only 17 years, from Barcelona in Spain. But I asked this boy that when you go for these competitions, for these contests, he's my foster son, what really happens? What do you do? Then he tried to run me through what they do in mathematics. And you see, the other thing that he said is, he said, that's why you find Apple, that's why you find Google, that's why you find all these. Yeah,
now they're scouts.
Exactly. That's why you find the Mark Zuckerbergs, that's why you find everybody. People who come to just look at this young talent and say, it is science, you know, it is science. And
I can invest here and I can make the money.
Invest here and I can make the monies. And you know, they
problem
task them
solving.
to say, problem solving. They task them to say, now this is what we need. Then these guys go vouch, look out and say, we will get this. What can we get from this particular fruit? What medicines are in this thing? What can we get from this leaf? What can we get from this? Now, that's what they call the pathogen economy. And it's one of the things that is actually now getting lots of monies from these countries. Just imagine, we talk about the vaccine here. We've not even vaccinated 10% of our population. We've not done that 10% fully vaccinated for our population. But just imagine now, let alone the donations that we get, that we've been given this number of doses from maybe China or the US or anything. But think about that, the medicine that we buy. We could task the minister here, and you could hear the minister saying, please, we have actually deposited $3 million to this particular farm. But they don't even have the medicines already, but we have paid money.
So
we kept quantifying and saying, members of parliament told us here they were getting cars of 200 million shillings. Then we did the mathematics and said, how many vaccines would this be? And for every vaccine, I think it was $4 or $5.
So all that is in
that is in the
proper explanation.
Exactly.
Why sciences should be prioritized.
To me, I have no problem. We need to prioritize them if we want to build our pathogen economy, because now that's the other way to go. That's the other way to go. We can. I have no problem. Let the scientists categorize themselves with whichever they want to do. It shouldn't be about just saying
finally,
we are in this
coming back
association also.
To the issue of the doctors. They met His Excellency, he made commitments, but they're saying we shall continue until these have been fulfilled, because for the last 4 years we've been engaging people. Don't you think it is time?
To do what? To
to end the industrial action and go back on duty after meeting with the commitments that also?
No, the industrial action definitely not be forever. It can't be perpetual.
It's not sustainable.
But it can't be perpetual. It can't be forever. They will get somewhere and then stop it. And of course, they started it knowing that they will stop it someday. What they wanted to do was to communicate, to send out a message, a signal, and to deliver a point. And because of that now, yes, they have had an opportunity to interact with the head of state. They've had these commitments, and which is actually very good for records. That yes, they have the commitments now. Whether it happens in the financial, it doesn't happen, it is on record that the president has actually promised, the president has said, and this is what we need to do. So that means what that means is that they will keep pressing on. They now have something to hold on to actually say, we demanded 3 years ago, nothing happened. We demanded maybe another 2 years ago. We demanded, and of course it also come and say, we demanded a few months ago when the president met us and he actually told us. So to me, I think they have voiced their grievances, their issues. They will definitely have to end the strike someday. They will end it, whether today or tomorrow, the other day, they will end it someday. But it just, we shouldn't just wait for them to end the strike. We shouldn't be praying that they should end the strike. What needs to be done is we need to find a solution to their problems. In that, when they get back to working, we should not expect, we should not again be taken by surprise that after July next year, when they do not see their increments, then again, they'll get back to our weather. So what I think needs to be done is we need to address their issues. We need to address their issues.
We need to address the issues, and entirely actually it's the entire health sector, because we know that one of the things that is a fundamental right, all rights, Jagena is one of the advocates of human rights, but for me I say life is the utmost right for anybody.
Human rights and mostly women's rights. I am a feminist.
Okay, I didn't know that. So when we talk about anything to do with health, I think this is a noble cause that we must prioritize. Jagenda said we do not lack money as a country, as Uganda, but we need to get our priorities right. Well, it's a humble call to the doctors that this is a noble profession that is aimed at saving lives. And of course, Jagenda says at one time it must end. But to me, I believe sometimes statements are made. I visited Chirudu Hospital. I think that was yesterday but one. And you could really clearly notice that the doctors are not there. And of course, our health system, it is sad, but that is the reality, that it mostly depends on interns, intern doctors, who sometime back kicked off.
But you see, now that's also an issue, and of course, part of the thing that you're talking about is the interns need to be paid. So, because it's part of the journey to have these interns. Now you can't become that senior doctor, you can't become that senior specialist without have gone through these internship processes. So, to me, what I think needs to be done is whether it's about interns or because you can't have specialists everywhere, and they're not even very many. We don't have many. For example, we have only, I think, 4 or 5 pulmonologists in this country. Those who are actually accredited, I think, globally. We have known about 4. And because those are also not many of our diseases. But now, when we went through the COVID period, it is when we actually discovered that you also needed many of these pulmonologists. Now we need to invest in them and say, what about...
And of course, having many of them that have went to other countries. Because it's also funny that when you travel to some of these countries, you're shocked. People who are working on you.
I know one of the best pulmonologists in the US. He lives in California. He's Ugandan. He left this country. He's been out of this country for about 30, 40 years from when he went. He's worked there. He's lived there. He's exercised there. So it's important. When you go to the Cancer Institute now, they've categorized the cancers now. They've categorized the cancers now. That it's not just a general cancer study or something. Now the oncologists have also now had these different clusters where you find somebody getting into pediatric oncology, the gyna oncologists. We have those who are doing this particular oncology, those doing this oncology, the derma oncologists and stuff like that. So we need to look into all these things, because now
how do we retain them?
Exactly.
How do we facilitate
when we have them? Exactly.
How do we provide the supplies they need? And because at the end of the day, there's a trickle-down effect that the citizens the key taxpayers then will benefit, because we need to see our public health facilities really desirable. Of course, you must commend government. There have been strides made. There have been strides made, but I think there's still so much room for intervention. Your parting shot, Jagena.
When we had the problem of the second wave of COVID-19, you remember when they talk about the skyrocketed bills or whatever they call them in these private hospitals. I had an opportunity to interact with the private doctors and specialists, and ask myself a question: that what would I do if I owned a private hospital? Semakula medical facility, and I'm treating cancer patients, and I'm treating COVID patients. What would I do? Because the taxes that come to them, the medicines, and specialized treatment is expensive globally, not only in Uganda, everywhere you go. Go to Italy, go to France, go to Germany, go to specialized treatment is expensive everywhere. So I think what needs to be done is lots of things. The conversations, these engagements need to go on. So, but the most important thing is it gets back to the government. We need to indict our own government to make sure that it actually builds our public health systems for the wananchi. If Jagenda has money to go and receive treatment in Mumbai, let him go. If Chirawa has money to go and be treated in Hamburg in Germany, let him go. If Nyonyi Ntono has money to be treated in wherever he wants to be treated in this world with a special doctor being flown from somewhere in a private jet, let him go. But the health systems need to be built for all of us. And of course, the other issue that is also very important, we can't just have the equipment, even when we have the medical supplies, but then the human capital development is also very important. We need to have people here that we take pride in and say, we've taken to a medical school, you've been there, we've trained you in our nursing schools and all the things, we've equipped you, we've put all this equipment in you, the knowledge and everything, the expertise, then we're actually doing it for you. You should find pride in working in our own hospitals, treating our own people, benefiting of course from what you're doing, but also giving a service to your country. Not saying I'll do this, then find myself, go, they do it somewhere else where they will give me more money.
Where we are saying you go to a public facility and you find that they are present but absent. Many of them are in private hospitals and they just run to government because that is where they were commissioned to work. So all these, there are a number of factors, and we need to look at our entire health system as a whole to improve the livelihood of the people, but also motivate those that are carrying out this noble cause. Well, have a lovely day, stay safe. Don't forget that we need to be vigilant at such a time when you have terror threats as well. But also COVID is still around. Go get that jab, get vaccinated. It will be a shame for Uganda to succumb to COVID-19 as a result of missing out on vaccination. Stay safe. God bless you.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.